Hello everyone, my name is Mahale. Today I'll be showing you how we can do a colostomy care. I have all my staff here with me, and this is my patient. First thing first, what we have to do is introduce ourselves and verify the patient, see the name, the handband, check for the name and date of birth, and then we're going to explain what we're going to do. We're going to explain the procedure. So in this case, as we do not have the an old colostomy bag, I'm just going to go ahead and verbalize it. So what we're going to do is we're going to go ahead in the room. As I said, before that, I wash my hands, and I'm going to put a clean glove. I wash my hands, do privacy. Make sure you provide a privacy to the patient, and then we're gonna go. And then after you wash your hand, you're gonna wear your clean gloves, and you're gonna go ahead and empty the old bag, and then discard it. And then after you discard the bag, this is gonna remain on the patient. This one that I'm going to use, and then with that one, when we remove it, we have to be very, very careful. So this is the skin, and it's gonna be sealed on this one, on the whole thing. This is our skin. So when we try to remove it, we just hold the skin and try to remove it very slowly, because I'm sorry, I really have a bad cough. Yeah, we have to be careful because we don't want to go ahead and damage the patient's skin. And then after we remove it, we're gonna go ahead and then wash all around it with warm water. And then after we wash it, we're gonna go ahead and assess the skin, if there are any skin breakdown, any redness, just to make sure that there is any skin issues. And then after that, after we assess it, remember I'm wearing gloves, okay? After we assess it, okay, no skin breakdown and all that, I'm gonna discard my old glove. I'm gonna wash my hand and put a new glove. And I'm gonna put my glove, and then I have this one that can help me to measure the stoma. That way I have the right that way I make the right hole when I try to make the circle one. So if it is this one, we're gonna go ahead and measure it and then cut it. What I did was after I measured with the measuring this the ostomy roller, I'm gonna go ahead and cut it. I pre-cut it, so I will save me some time. So I had it pre-cut, and then after that, we're gonna make sure you dry the skin around the stoma, everything, and apply there is a skin protector that we need to apply around the stoma. So we're gonna apply that, and then after that, I'm gonna open this. And take this thing out. It's actually hard to take it out with the gloves on. I'm gonna go ahead and take this out. So, and then I'm gonna go ahead and apply it. It gets sticky. So we're gonna go ahead and apply it. You see? Make sure you seal it, everything. Or if we want, we can go ahead I forgot to do it, but we can clap it here. so it will be easier for us. We're not supposed to do it this way, but just because I used this one already and it's not gonna be the same if I redo it. So make sure you clamp this together before we apply to the patient. That is very important. I should have done that because now I wanted to redo it, but like this is gonna be hard for me. But we make sure we clamp this too before we apply to the patient, and then make sure you close the clamp. So for this one, just gonna roll it. We have to secure this patch because we do not want any leakage or anything, right? So we're gonna attach it like this. Okay. Ask the patient if they're comfortable and if they're having any pain or not. If they're good, you're gonna discard your gloves, wash hands, undo privacy, and document the procedure. And if they're just contact, communicate if there is any other concerns with your team. Thank you so much.